Good day, everyone. My next lesson is we have lesson number 2 for topic 1. The title is Assessing Part 1. There will be assessing part 2, that's part of lesson 2.1. Okay. I included assessing because I noticed that some of the students are having a hard time identifying what to include in their assessment. So my goal would be to correct your misunderstanding of the rules in making your assessment and what are the rules in identifying what information or what data need to be documented. So these are the learning outcomes. So I hope you go over the video again. You should be able to achieve the following outcomes. Define assessment, know the types of assessment, give example of each type of assessment, differentiate data if information is subjective or objective, know the sources of data, and list methods of collecting data. Okay. Okay. Now, this question might look familiar to you, but this is one of the question in the quiz last July 6th. So it was about Linda Evangelista, who was a student nurse taking care of Kate Moss. So the question actually was to identify which of the following documentation by the student nurse is inappropriate or which data should not be included. So as you can see, the correct answer is actually the last options, which we will know later on. So based on the result, only 34% of the students were able to get the correct answer. Okay, so now you can see the add pie. You don't need to read the details on the left side, on both sides. So we have the add pie here just to remind you. So we have the assessing, diagnosing, planning, implementing, and evaluating. So maybe you have been using a different term: assessment, nursing diagnosis, planning, implementation, and evaluation. So that's the same. So assessing is the systematic and continuous collection, organization, validation, and documentation of data, or that would be the information. It is systematic because, as you recall in your physical assessment, there is a pattern or there is a standard that you follow in doing your assessment. For example, if you do physical assessment, you may proceed by following cephalocaudal pattern or from head to toe or head to toe. Okay, so now to guide you with assessing, so sorry. Okay, sorry. Yes. Okay, now if you look at this, we have a mnemonics here. We have the COVD. We have the COV-D. Okay, so these are the procedures in doing your assessing. First, you collect the data, then you organize the data. Once you have all the necessary data, you validate them, and then documentation of your data. Okay. Now, these are the types of assessment. We have 4. The initial assessment, problem focus, emergency, and time-lapse reassessment. Okay, so first one, initial assessment is the purpose of initial assessment is to obtain a complete database, or basically the information gathered that would be your baseline data. For example, when a patient is admitted, there should be a initial assessment. Compared to other types of assessment, initial assessment is quite longer, because this is the period, or this is the process where you take everything, like physiological assessment and also psychological assessment. One of the example is like how does your patient cope with depression, and also it is the time where you ask the patient about his religious belief, perceptions about health. So that's the nursing admission assessment. Next, okay, the problem focus. So problem focus, as you can see, it sounds familiar because I see that you have been doing the FDAR, or the focus charting. So problem focus is a bit shorter, because the focus is let's have an example in your FDAR. If your focus is fever, then you will be initiating an ongoing assessment. So let's say you work at 7 a.m. At 7 a.m., your client is febrile. You provided TSB, then you recheck the temperature at 8 a.m. So rechecking of the temperature at 8 a.m., that's already a problem focus assessment. So it is an ongoing process. The purpose would be to determine the status of a specific problem. So the example here, as you can see, I&O monitoring. I&O is also known as, that's the intake and output monitoring. So you monitor, you measure everything that the patient that is taking, that the patient has been the volume of the patient's urine, any number or episodes of vomiting. So let's say your focus is oliguria. You noted that your patient has oliguria at 8 a.m. Then later on, as part of your nursing intervention, you encourage patient to increase the fluid intake. So from 8 a.m. to 9 a.m., then later on, for example, at 10 a.m., you check the output of your client. So since the problem was oliguria, you promoted increased fluid intake. You reassess the patient a few hours after to identify if there is an increase in urine output. So that's one of example of problem focused assessment. Next, so emergency assessment, you only do this. You do this if there is a psychological or physiological crisis. So, for example, you have a client in the ward. When you get inside the client's private room, you found a client lying on the floor, unresponsive. So what you usually do is you make an emergency assessment. You check the ABCs. So what are ABCs? A is for airway. So you check the airway of the client. You try to open the mouth. If you remember your training in emergency nursing or emergency response, you make a jaw thrust. You check the mouth for any blockage. Then letter B for breathing. So you listen. You put your ear near the mouth of the client and listen for any ventilation or any breathing. And then C for circulation. You palpate the carotid pulse or the brachial pulse for pediatric client to check for any presence of circulation, or in short, you are checking the pulse of the client. So it is a rapid assessment of ABC during arrest. So that's emergency assessment. Okay. Lastly is we have the time-lapse assessment. Time-lapse assessment done usually a few months after your initial assessment. Let's say you have a client who was admitted last January, and then the client goes back at 3 months after in the hospital through outpatient department. So you perform time-lapse assessment to check and compare your current data or your current information from the baseline data. Baseline data, that would be all the information, all the assessment done in January. Another example is change of shift. Let's say nurse 1 worked for 7 a.m. to 7 p.m. and you work for 7 p.m. So before you start providing care to your client, before you begin your shift, you make a time-lapse reassessment of the client. Okay. Now, collecting data. So, you already learned the type of assessment. So, when you collect data, it is a process of gathering information about the client. But there are several types of sources of data, not just from the client, but you should always remember the focus is the client. So aside from asking your client, you will also collect data from the health history of the client. Let's say, for example, if your client had been diagnosed of cardiovascular disease, and also if physical assessment done by the physician or other staff nurses, that can also be a part of the data. And also the laboratory result or the lab result. Let's say the urine specific gravity is 1.030, so that becomes a part of your data. Okay, so what are the types of data? So there are two types of data. We have the subjective and objective. So subjective data, they are the symptoms. So you should always remember that any symptom reported by the client is the subjective data. So CC or chief complaints, ideally, it is a symptom reported by the client. So, covert data, it is covert because you cannot see it, you cannot feel it, you cannot observe it, and you will only know about a covert data if a client reported it. So, it is felt by your client. And another example of subjective data, it is not limited to anything that is stated or verbalized by your client. Another example, if you identify the perceptions of the client, that becomes your subjective data. What is a perception? For example, patient Linda is an obese client, an overweight client, and she tells you that, I don't think that being fat is unhealthy. So that's her perception towards health. So that becomes a perception of the client, and you put that in the subjective data. Another example also here are the beliefs, the religious belief of your client, the values, and so on. So objective data are the signs. So the signs or any cues that you see in your client. So, for example, if you see the client is rapidly breathing, so the client is tachypneic, then that becomes a sign. So, compared to subjective data, objective data are overt data. So, when we say overt, it is easily, or it can be seen, or it can be observed by the nurse. So objective data are anything that is detected by the nurse. Okay. So you should always remember, guys, that to avoid confusion, objective data is anything that you see from your client. So basically, you are using the senses. So actually, ideally, it is the usage of four senses: sense of hearing, sense of sight, smell, and touch. Okay, so if you see the client having a flush skin, so you're using your sense of sight, and then when you palpate the muscle or when you palpate the skin of your client, you're using your sense of touch. Okay, so now here's an example. So okay, now here we have a patient. Let's say you're making your FDAR and your focus is the pain. So we have here, the first one is the facial grimace. So you are looking at your client. The client is making this face. Of course, if you are in pain, you exhibit a grimace face. And then you ask the client, to rate the pain. And the client rates a pain on a scale of 8 out of 10. Diaphoresis, of course, if an individual is suffering a pain, a person would experience diaphoresis, or that is excessive sweating. Pinapawisan ka, right? Okay. And then if you are in pain, then there will be tachypnea. Tachypnea, or let's say in this case, the patient's respiratory rate is 29 cycles per minute. So that's a beyond normal limit for an average adult. So the client is rapidly breathing. And of course, because of the pain, the BP might be increased. So in this case, the patient has a blood pressure of 150 over 100 millimeter of mercury. And also, the patient states, or the patient tells you, oh, my pain, my chest hurts, or masakit yung dibdib ko. Hinahawakan niya yung kanang dibdib niya. Okay, now, here's what we need to do now. Let's start with the facial grimace. Okay, where will you put facial grimace? Would it be subjective or objective? Okay, now let's describe facial grimace. If you are the nurse, you're looking at a patient having chest pain, so you will look at the face, you will use your sense of sight, and you will see the face. The patient is making a grimace face. Therefore, you observe it, you see it. So, facial grimace becomes your objective data. So what about the pain scale of 8? What's your answer? Is it subjective or objective? Make your answer now. Okay? Now, pain scale, always remember, it is not the nurse who rates the pain. You will be asking your client to rate or to evaluate the pain. So the patient gives you answer, the patient will tell you, it's so painful, I can rate it, it's 8 or 9. So pain scale, it is a subjective data. What about diaphoresis, excessive sweating? Of course, you will see the patient. When you touch the patient's skin, you would know that the client is diaphoretic. Okay, you don't need to palpate your client, you don't need to feel the skin, but you would see excessive sweating by using your eyes, right? So it becomes your objective data. What about the respiratory rate of 29 cycles per minute? Of course, it is the nurse who counts the respiratory rate of the client. So RR becomes your objective data. Blood pressure, you measure the blood pressure using your sphygmomanometer, then that's your subjective data. Okay, what about the statement or the verbalization of your client? Okay, is it subjective or objective? Yes, it is subjective. Anything that is stated or verbalized by the client is subjective data. Okay? Okay, so these are the summary. We have the subjective and objective. So it is symptoms versus the signs and so on. Okay, let's go to the next slide. Okay, so we have the sources of data. Where can you get data from? Okay, there are two sources of data. So we have the primary data and the secondary data. Primary data is any information gathered from the client. Anything that your client verbalizes, mentioned, or tells you, that becomes your primary source of data. Secondary data is any information given to you by the family members or the caregivers or the friends and relatives. Also, information from the physician and the lab results. Okay, the result of the urine analysis, the result of the complete blood count, that's your secondary data. Okay, now, we have data collection method. So we have the principal methods of data collection. We have three. We have observing, interviewing, and examining. Okay, that should be very easy for you because observing. Okay, sorry. No. Okay, observing is you are using your senses, sense of smell, sense of touch, and so on. That's your observation. Physical assessment, that's your observation. Okay. And also, let's say you get inside the room of your client and you see that the client has intravenous fluid. That's become your observation. Okay. And also interviewing. Okay. Interviewing is also a collection method that should be very easy to understand. And when you talk to your client, when you make a planned communication or conversation, any data that you gathered from speaking with a client, that becomes your information through interviewing methods. And of course, examination. When you do your physical assessment, for example, for examining, so that's one of the methods. So we have physical assessment. Okay, next. Okay, now this is the end of lesson 2, but before we end the lesson 2, let's go back to what happened to Kate Moss. Okay, so the student nurse was Linda Evangelista. So between the grimace face in Patient in Pain. Okay, always remember, I would like to give you back the question. Kate Moss was voiding on the bedside commode. While Kate was voiding, she was manifesting a grimace face. Then the next data mentioned in the question was urine output was 80 ml and the color of the urine was dark amber. Okay, so those were the data. Grimace face, 80 ml of urine output, and dark amber. Now, my question for you is, will you document grimace face and also Patient in Pain, or will you write down grimace face only? Now, formulate your answer. What's your answer? Okay, now always remember, if you go back to the question, yes, grimace face, you need to document it because Linda Evangelista, the student nurse, observed it. She saw Kate Moss manifesting a facial grimace, right? Patient in pain. What about patient in pain? Will you document patient in pain? Formulate your answer. It should be no. Why? Because there was no mention of pain. Okay, if you go back to the question, the data were only as follows: facial grimace, 80 ml of urine, and dark amber urine. There was no mention of pain. Not unless if Linda Evangelista asked for to rate the pain, to give a pain scale, then definitely you need to put it down. However, most of the students, they wanted to put also patient in pain. It was actually a distractor of the question. Okay, so you do not include patient in pain because it was not part of the assessment. Okay, so that ends lesson 2. So I will post lesson 2.1 later on. Thank you.